Good morning. This is Deborah Melamed from BeatCancer. I'm the Director of Community Outreach, and I'm coming to you today with an incredible amount of education, some vital information that we all need to know about and become really aware of. I'm here with Philip and Liesha Getson from Thermographic Diagnostic Imaging, and today we're going to talk about thermography. So we all know what mammograms are, but only some people know what thermograms are, and they might know what the word means, but they kind of know it's not covered by insurance. And what we need to do today is really explain to you what it is, what all the test options are, what you need to know in order to make a really great decision. And we have two great people here to help you out with them. So, with that information. So, good morning and welcome.
Thank you for having us.
Very excited to have you and to spread this vital information. Why don't you tell us about thermographic diagnostic imaging and about yourselves?
Okay, you want to talk about that?
Well, thermographic diagnostic imaging was started in 1982 when we came to the realization that we were looking for a different way to evaluate patients' health. Thermography uses infrared, which is a non-penetrating device, so there is no radiation like other conventional diagnostic testing. It's a screening tool that allows us to take the body's heat and create a pattern which can be analyzed to determine health at the earliest possible time. Thermographic cameras are FDA cleared. They were cleared back in the 1980s, and they're completely and totally safe. So we use this primarily as a screening tool for breast health, although we also evaluate thyroid issues, dental issues, and neuromuscular issues. And we do it, as I said a moment ago, without radiation and also without the compression that's inherent in mammograms. Thermography, because it's a physiologic test and not an anatomic test, will evaluate the health of the body way before anatomic tests do, because physiology precedes anatomy in medicine, in every facet of medicine. And in breast health, it's reported in the literature that thermographic evidence of abnormalities can occur 7 to 10 years before a mammogram will find a tumor the size of a pencil eraser. So it allows women and men a proactive approach to breast health or general health by being able in a very safe, efficient way to determine whether or not the body is functioning properly and allowing individuals to take necessary steps to correct any malfunctions.
Okay. So there's no harm.
No harm.
There's no downside.
None whatsoever. We can
Really nobody that can't get a thermogram.
We can look at women from 18 to 80. We can look at women with breast implants, people who are pregnant, nursing, women who have had mastectomies. We can look at men because we're looking at the anatomy, we're looking at the physiology, not the anatomy. So none of those anatomics. Breast implants, not a problem. We don't have to worry about trying to move the breast implant. We're looking at the physiology. So scar tissue, none of those things affect the thermogram.
Okay.
Or impede our ability to be able to see what's going on because we're looking at the physiology. And the physiology, as we know, predates the anatomy by 7 to 10 years.
Okay.
Giving us and women a huge window of opportunity to intercede in a healthy diet and lifestyle modification, getting rid of underwire bras, switching from antiperspirant to deodorants, and so on, getting hormones balanced. There's many, many things that women can do to increase and maintain their breast health.
Okay, so this is true early detection, where a mammogram will detect a tumor.
Right. If a mammogram detects something, or you feel something on a palpable exam, you've probably had it for at least 7 years. It takes about 7 years for those cells to become the size of an eraser head, and only then is it palpable or readable on a mammogram.
And that's really too late. We want to know 7 years before.
Right.
make the changes and never have a tumor and cancer stem cells. And is it true that there's some cancer cells in the breast all the time, that our immune system is taken care of, they're there?
Absolutely.
Everyone lives in harmony. And then the mammogram will squish the breast and sometimes rupture those cells, I was reading, and actually can cause a metastatic type of situation then, where there may never have been a problem.
It's true. The compression of a mammogram is about 44 pounds of weight. Wow. And it takes about 30 to rupture the capsule of a tumor. So it's about 25% more than it would take to rupture the tumor. So why
shocking.
Want to take a chance of compressing the breast and rupturing a palpable mass? I mean, it's illogical. It's an illogical approach to medicine, as is the idea that we're going to wait until you get the tumor and then try and find a way to undo it via surgery or chemotherapy or radiation. It makes a lot more sense, and it's 5,000-year-old concept of Eastern medicine, which is the proactive approach to health. Let's make you healthy rather than trying to undo something once you have it.
Or keep you healthy. Let's maintain health.
Right.
Yeah.
Sounds like a
so
no-brainer.
That radiation, you take that compression in, right, for about 44 pounds of weight, and then that compression is damaging those tender breast cells, breast tissue cells on a cellular level, and then you're hitting it with a very focused amount of radiation.
Right. So you damage the cell and then radiate it.
Right. So the party line is, well, you get the same amount of radiation in an airport. Well, that's not the case. You know, you have now just damaged the breast on a cellular level, and you're hitting it with that focused amount of radiation. In an airport, you're getting radiation, but it's throughout your whole body. It's not in a localized focus area that's been traumatized.
Moreover, there was an interesting study down in California a few years ago that said you're not only damaging the existing cells, you're creating damage on future cells that have not yet even formed.
Really?
Right. Yes.
That's just shocking.
Mm-hmm.
See, people really need to understand this, because it's what their doctor tells them. And in fact, I had microcalcifications and they kept wanting to do one mammogram after another. And then I had a lot of breast cancer in my family. So I thought, oh, it's genetic. I have to make sure I get all my mammograms. Well, cancer is really not genetic. If there's a very small amount that's genetic, just habits run in families.
Right, exactly.
So it's not really genetic. You have control, and your lifestyle choices, and the screening tool very early on is wonderful, because then now you take your power back and you make these lifestyle choices before you have a bigger problem. So I'm just such a fan of thermography, and I've had a couple with you. So do you want to tell us what the process is so people understand exactly what it looks like and what it feels like?
Yeah, sure. Well, we have our main office is in Marlton, New Jersey. So as far as where to go, you can come here to our main office, or we have 20 off-site locations throughout Pennsylvania and New Jersey. And those locations are on our website, and I will give the website information at the end. Mm-hmm. Basically, what you do, you call, you make an appointment, we get the paperwork out to you, history forms with some instructions. You arrive at the time of your appointment, maybe 10 minutes ahead of time. You'll go into the room that we're using for thermography. Depending on where we are, we follow the same protocol. We're using the same equipment. It's me or one other board-certified thermography technician that's taking the pictures. Dr. Getson is reading and interpreting all of the pictures and generating all of the reports. So you're getting his many, many years of expertise when it comes to that. And then once the patient receives her packet, she has the opportunity to speak directly with Dr. Getson. Anyway, so the woman goes into the room, disrobes, depending on what study we're doing. If we're doing a breast study, she would disrobe from the waist up, top, bra, necklace, get her hair back up and off her neck and back, and acclimate to the room temperature, which is kept at about between 68 and 70 degrees for thermographic purposes. So it's a little chilly, but not terribly uncomfortable.
No.
After the 10 minutes, it's not too bad, right? After the 10-minute acclimation, we do the first set of pictures, 9 pictures in color. The woman is standing with her hands resting on top of her head. So we're looking at the breast from every angle and looking up into the underarm, looking at the whole lymph section. Then we do a little cold challenge. The patient holds an ice pack between her hands for 1 minute, and that's just to stimulate some blood flow by making the hands cold. The heart starts pumping to warm the hands up, blood starts flowing into the breast, and it kind of lights up those blood vessels for the second set of pictures that I take in black and white. Also, it's the same 9 pictures. So total of 18 pictures. After the second set, patient gets dressed. We're going through the history as they're acclimating. So it's very efficient as far as the time. Time spent is about a half an hour. Then, as I said, Dr. Getson reads all of the pictures, does all the interpretation. So that takes about 2 weeks' time. Mm-hmm. Patient gets the packet mailed out to them with the pictures, the report, and a claim form for insurance, a universal claim form. And then that time, they have the opportunity to get on the phone call list and have a conference with Dr. Getson to go over the findings.
Okay. I found it very quick and easy.
Comprehensive and
not very stressful at all. I mean, less stressful than a mammogram.
Right. Yes. Yeah. Well, most women actually do report that it's a pleasurable experience. They felt they weren't scared or apprehensive, and came out of it feeling very well cared for.
Yeah, and it didn't take very long.
No, half an hour.
Mm-hmm.
Yep. And then so if we also do a thyroid dental facial study, that wouldn't require you to disrobe. We would just be able to image the throat. We're looking for thyroid dysfunction, which is rampant these days. The blood work is not showing or reflecting that there's thyroid dysfunction, but people have all the symptoms. So the thermogram is looking at that, which is great because then they can get treatment if we're finding something off with the thermogram. We're also finding dental infections that the conventional x-rays miss, which is so, so important, right? We have 8 teeth that are connected to our mammary glands alone. So all of your teeth are connected to all different organs in your body, different parts of your body. If you've got an underlying systemic infection in there, your body will not be able to fight that off without intervention from a biological holistic dentist. So you need to get in there and get that cleaned up.
A major root cause.
You need to get to the root cause of that, for sure. And then we're looking at the sinuses to see if there's sinus infection going on.
Okay, so they're the kind of the other uses.
And then the last study, right. And then neuromuscular, it's really looking for physiologic chronic pain syndromes like fibromyalgia, reflex sympathetic dystrophy, also known as complex regional pain syndrome.
Do you have men come in for thermography?
Sure, absolutely. We see a lot of men doing full bodies, and we see a lot of men doing the thyroid dental facial studies. And I've had some men with breast, doing breast thermograms for
tumors. Can it detect prostate cancer at all if you do a full body?
No.
I'm curious about that.
Yeah.
Okay.
Good question.
Okay.
Not yet. Maybe in the future.
Wouldn't that be nice? So, what if you do have a thermogram that comes back with, well, first of all, you kind of need a baseline, correct?
That's correct.
Okay, so you come in and you kind of have a baseline. Do you normally follow up in 6 months or a year?
If the baseline is unremarkable and there's no areas of thermographic concern, we ask women to return in a year.
Okay. And then the second time now you base it on the baseline.
Correct. The premise of thermography is that the human body is for the most part symmetrical left to right. So you're comparing the left side of you to the right side of you because there is no standard temperature or standard vasculature. By the second time, we're now comparing not only left to right, but the first one to the second one. Now, if an individual comes in and the first one is either questionable or abnormal, we shorten that 1-year waiting time to 3 or 6 months, depending upon the amount of concern that I might have looking at the images.
Okay. So then do you kind of point people in lifestyle, diet change, if something happens to come up? What kind of do you make any recommendations of other tests, or how does that work?
Well, as a general rule, if I see a focal abnormality, meaning that there's a portion of the breast that concerns me, we talk to women about the possibility of undergoing ultrasound because, as you know, ultrasound, again, is non-invasive, non-radiologic, non-compressive. And while there is contact, it's not that 44 pounds of pressure on the breast. It's a diagnostic test that most insurances cover. It's fairly simple to do. And given that the thermogram provides an area of concern, it allows the radiologist interpreting the ultrasound to sort of have a roadmap and know where to look. Other diagnostic testing that's available is mammography and MRIs. And if the breast is globally abnormal, we try and see if we can arrange to have someone have an MRI in order to get more information. It's a matter of discussion between the patient and me in terms of recommendation. And we always send a copy of the report to any attending clinician that the patient wants. So their doctors or nurse practitioners or nurse midwives will have a copy of the report as well so that they can be a part of the process.
Okay. Okay. That's very interesting because I was kind of reading that you don't actually need a prescription for an ultrasound because it does no harm, but that a lot of doctors won't give you a prescription, or they won't give you a prescription for an ultrasound if you haven't had a mammogram. So I think it's kind of a difficult thing. People were saying schedule them the same day and then get your ultrasound, or I don't know. I'm crossing that bridge next, I think, because I had a little extra heat there, which I didn't have before. So I was kind of going through some of these lifestyle choices and seeing what my next kind of moves would be. But I kind of heard that really there's no state law that says you can't have an ultrasound. Your insurance company isn't really demanding it. So you kind of have to get in your doctor's face and ask why. Why can't I have an ultrasound?
It's
Are you denying me my benefits?
Right, regulation made by the imaging centers. There's no law, state, federal, or local, that says you have to have a mammogram to have an ultrasound.
Right.
It's just the way that the imaging centers have set it up to do. And there are some centers that will do an ultrasound without a mammogram.
Right.
There's one local to us that we have a working relationship with. And women have found places in different areas of Pennsylvania and New Jersey. But mostly the centers will give the woman a hard time saying you have to have a mammogram, and it's just simply not true.
I just wanted people to know that.
Right. And there are some, for instance, if a woman is, say, only 35 and she has a questionable thermogram and needs to get an ultrasound, she's not going to subject herself to a mammogram at the age of 35 because, as we know, her breasts are dense, right? 99% of us have dense breasts until we're at least 50, although I see women in their 70s that still have dense breasts. And what does that mean? If your breasts are dense, that the mammogram may be inconclusive because they cannot read dense breasts. The tissue is too, it's like trying to find something white on a white piece of paper. You just can't see it. So there is a breast density law now in New Jersey that states the woman is supposed to be told that due to breast density, the mammogram may be inconclusive. And that is stated on the bottom of her paperwork or of a report. So, and I don't know if they actually did it. There was talk of changing the guidelines to not start doing mammograms until you're age 50 and to do them every other year due to breast density and the fact that there were so many people being overdiagnosed to the tune of 800,000 unnecessary biopsies done a year. That's a lot.
In a biopsy, if there is something there, now they're sticking a needle in and pulling those cells out.
Right.
And then that's a metastatic situation.
Yes.
Which is what you do not want.
Do not want that.
No, that's the worst possible thing.
Exactly, yes.
So people need to understand the dangers of mammograms and what the alternatives are, because there are alternatives. And we're presenting you one right now that can do no harm. And I wanted people to really understand that, because you may not have had any issue. You get a biopsy and now you have an issue. Or
Right.
you pressed your breast and now you have radiated it and now you have an issue.
Right. We've seen
So
that.
it's very strange to have a test that can actually, that's not even early detection, that can actually create what you're trying to avoid.
Exactly,
It
right.
makes absolutely no sense.
Exactly.
And yeah, I think the biggest harm of mammography is, we talk about the radiation, of course, we talk about the compression, and certainly everybody has heard those. But I think the biggest harm is the overdiagnosis, because what happens is that they're seeing these little tiny lesions that will never cause a woman to die, to get ill. And they're going in and biopsying them, and they're creating havoc. I mean, they're creating situations where you need to do this or that or the next thing. The amount of false positives is incredible. And the treatment that is rendered to people who don't need treatment, not only in people who have biopsies that turn out to be negative, but people who have biopsies that turn out to be slow-growing cancers at the age of 50 or 60, and these people would live to 100 as far as the breast is concerned. And they're talking about radiation, they're talking about surgery, they're talking about chemotherapy, and
Doing more harm.
they're doing more harm with the treatment than would ever be. And you talked earlier about microcalcifications, and statistically, 85% of all microcalcifications are benign.
Right. Well, I kept going back, and they kept showing nothing, and then I started reading, and I never did another one again.
Mm-hmm.
And of the remaining 15%, most of the cancerous microcalcifications are very slow growing and not harmful. And it's a fact that's even been recognized by the American Cancer Society, whose president said we're overdiagnosing and overtreating.
And these
the fear that's instilled then too. I mean, that's really that fear that's very scary for a woman.
Right. I wanted to talk about that, and also just to mention that some of the things that Dr. Getson is mentioning are in our PowerPoint. So we've got all kinds of statistics from New England Journal of Medicine, the cancer societies, not our statistics, but if anybody wants access to that, we can make that available to you, and it's on our website. But I'd just like to talk a little bit about that fear factor, right? So you give a woman a diagnosis of a suspected breast cancer, or you call them back for biopsies and additional mammograms. The amount of trauma, mental, emotional, physical trauma that these women are going through is criminal. It is so devastating to them and to their families that the fear factor is just, you cannot, I can't explain.
The body, it puts the body in a place for cancer to.
Right, exactly. You're so stressed out. They're so afraid that they have cancer that it's just, I just, they're in my office and they're crying, and they're just absolutely devastated. It's horrible. And people are getting treated for something called DCIS, ductal carcinoma in situ, which they were supposed to change that and take the word carcinoma out of it because it's not breast cancer. And right. Dr. Getson can talk a little bit about that.
I get calls from people with that a lot.
Right, but women are actually getting chemo, radiation, and mastectomy for something that's not even breast cancer. That is absolutely criminal.
It is.
Yeah. Can you talk a little bit about DCIS?
They were going to change it to something called IDLE, indolent lesions of epithelial origin, because when you see that word cancer or carcinoma, the automatic assumption is that it's cancer, and it's not. And this is coming from reputable sources. It's coming from the American Cancer Society. It's coming from noteworthy breast surgeons and oncologists. And I guess 5 or 6 times a year, we'll see someone who's come in to have a thermogram who had a mastectomy for DCIS that doesn't have cancer.
Oh.
And all the sequelae that goes with this, and it's just horrible. And I think that, again, when you talk about false positivity, women need to be educated. The information is out there. It's easy to find on the internet. It's coming from well-researched, reputable sources. There's a group in Norway called the Cochrane Group that studies outcomes. They don't actually do the research. They take the data and correlate the data and provide an outcome from that data that other people have done. And they did a study a couple of years ago that said that if, what was it, 2000? If 2,000 women had a mammogram annually for 10 years, which is 20,000 mammograms, the number of women whose lives would be saved as a result of the mammogram was one out of 200, because the rest either would have been overdiagnosed, underdiagnosed, or had tumors that didn't have any impact on their life anyhow. And so when you see these kind of statistics, when you see research that spans 25 years of studying women, which some of it was in the Journal of the American Medical Association, when you see this kind of research, that's not just 10 people or somebody who has an individual bias. You're seeing women that have been studied cross-sectionally in Canada, in the United States. You come to the realization, as you said earlier, that sometimes the treatment and the diagnostics in treatment are worse than leaving people alone. And the outcome from the Nordic Cochrane group was the best way not to get cancer is never to have a mammogram.
And the end part of that was that they were able to save one woman's life, and 10 healthy women underwent chemo, radiation, and mastectomy, treated for cancer that they didn't have.
You know, I did some Facebook Lives with Jenny Herbacek, and she wrote "Cancer Free, Are You Sure?" She's a breast cancer survivor. And she said, people think a biopsy is like this little thin needle that just goes in, it pulls a couple cells out and you leave. She said, it's not like that at all. It's a very invasive, painful, very disturbing. She said her breasts looked like an eggplant when they were done. Horrible.
Ugh.
So what about all those biopsies that were unnecessary also? I mean.
Right. Well, we have seen thermographically in some cases where there have been biopsies. Breast was healthy before that, but then problems start to develop at the site of the biopsy.
Oh,
maybe you could talk.
And moreover, when they do a biopsy, in almost every case, they put a titanium chip in as a marker so that they know where to look in the future. And you're still
I never knew that.
I had a woman just exactly this week who told me that she doesn't really mind doing the biopsy that her doctor suggested. She had an abnormality in her thermogram that matched up to an ultrasound and a mammogram abnormality. And so there was a high suspicion in this particular individual that she was dealing with a cancer. And she was still debating what she wanted to do, but she at one point in time had titanium in her body for another reason, and it made her physically ill.
Right.
So she said, I don't want that chip, and why do I need the chip?
I never knew that.
It's into everybody. So it's not only the biopsy that you're talking about, but it's the insertion of this titanium chip.
It's not for that metal in your body, right? I mean.
Right.
Wow, I never knew that.
So you know, I think that one of the great things that makes us sad is that there's so much information out there to be garnered, and so many women, more than men, because we're talking primarily about women in breast disease, so many women go into the doctor and the doctor says, you know, go do your mammogram, and they run ahead and do the mammogram, and the mammogram is questionable, and they go ahead and they do their biopsy, and the biopsy is kind of questionable, and they go ahead and they have this, that, and the next thing done, whether it's chemo or radiation or extensive surgery, and it's all unnecessary. And it's not unnecessary, again, as Liesha said, because of things that we're saying after all these years. It's unnecessary because when you read the medical literature, okay, it's not something that should be done. Right. It should be done through diet and lifestyle modifications and annual or semi-annual or quarterly monitoring.
Right. Because prevention is better than treatment. And even if you do get a diagnosis, you're going to have to change your lifestyle and diet anyway.
Right.
So, do you want to talk about that a little bit? What kind of diet and lifestyle modifications do you suggest?
Well, we talk about removing or not wearing underwire bras. You know, that you have that underwire bra compressing the breast, digging into the sides, and you know, in the middle, but mostly in the sides. And I can't tell you how many women that end up with starts out to be a little sensitivity on the side of the breast. Then before you know it, they're feeling a little lump, a little denseness, a little something there where that underwire is hitting, because you're starting to get lymphatic congestion. So you want to forget about the push-up.
You want to tell people what the lymph system is, just in case?
Right. Well, the lymph system, I mean, basically, here in the breast and up under the arms. This is your lymph system, which helps to push toxins out of the body. So you want your breasts to be able to move. If your breasts are constricted in a very tight bra with an underwire, your breasts are not able to move. Your lymph system is what moves the toxins out. So you've got to get that moving. That's why people will do rebounding, or while you exercise or walk or whatever it is you do. So you want to move those toxins out of your body via your lymph system, via the underarm, sweating, right? So that's why you don't want to use antiperspirants. Number one, because you don't want to stop your body from sweating, and most conventional antiperspirants have aluminum in them. So woman is in the shower, she shaves her underarm, she gets out of the shower, now her pores are all open, she puts on an antiperspirant with aluminum in it. It's going right into the underarm, into the breast lymph system, and now her body doesn't have the ability to push those toxins out because she's got an underwire bra on and she just put antiperspirant on.
Okay.
So get rid of the underwires. We did a little experiment one day here at the office. Leaving the office, somebody had an underwire bra on and they put their car fob, you know, the thing that opens up your car door, just held it up against the underwire bra, and it opened up her car door out in the parking lot. So they act like little conductors for the EMFs too. You go online, you know, we have all this information now at our fingertips. There's all kinds of studies out there that they're these little mini conductors, and we know that the EMFs, electromagnetic fields, are everywhere, right, with all of our. So that's two very simple things that you can do. Of course, and BeatCancer.Org, I'm looking right at one of your brochures here. It says 90% of all cancers can be eliminated through diet and lifestyle modifications, and science agrees. So look, we've got to eat real food, right? Mm-hmm. Organic, non-GMO food, mostly maybe a plant-based diet. 80%, we do the 80-20%, 80% plant, maybe 20% lean, organic protein, or some sort of healthy carbohydrate. Right. We don't subscribe to one diet or another, you know, although if people want to do that, that's fine. We just say, just eat real food. And yes, is it difficult these days? Is organic maybe a little bit more expensive? Maybe, but listen, Costco has organic food now. And from somebody told me that Costco has their own organic farms. It's not a matter, it's a matter of your health. I mean, you're talking about what you're putting into your body to create long-lasting health.
Money on, and you're either going to spend now or you're going to spend later, because a cancer diagnosis is financially devastating.
Yes, right. But not to mention what, you know, if it's just going to make you sick with all of the pesticides and the herbicides and the antibiotics. I was listening to a summit on my way in today saying for pork, you know, they would use the stool from animals to fertilize. They don't have any, they can't do anything with the stool from the pigs because they are so toxic. There's so many antibiotics in there, so many pesticides, that they don't know what to do with it. Wow. They don't know what to do with it. You can't even move it across state lines.
Really?
Yeah.
I stopped eating pork. I did read bad things about that. Yeah.
Yes, right. So, I mean, that's in a nutshell.
Up with wild salmon.
Right. Salmon, right? But not farm salmon.
No, it has to be wild.
It has to be wild. You know,
you only need a small portion.
Right. Got to be careful with our fish because of the mercury. So I really, you know, I like sardines for that reason.
They're small.
Right. So
how about coffee and water and
right, sure.
That toxic load. So we want to keep not be dehydrated.
No, we're 70% water, right? So we need to make sure we're intaking enough water, and they say half of your body weight in ounces of water. And then, okay, what kind of water do you drink? So we want to get filtered water, Fiji water. I still use the pH drops that were recommended when we took the Beat Cancer education class.
Okay.
So, that's a big thing, what kind of water, but just make sure you're drinking water. And what was the other question? You said water and
coffee. I know.
Coffee.
I've seen that. I saw that on your list.
Yeah, coffee can exacerbate cysts, right? So if you tend to be fibrocystic, coffee can exacerbate that, as will sugar and alcohol.
Sugar and alcohol.
Right. So if you're going to be drinking coffee, just make sure it's organic. And nothing against Starbucks, but maybe not the Starbucks supercharged, full of sugar in the creamers, all of that sort of stuff. And
you never know if they're using fluoridated water, what type of water. So if you make it at home with filtered water and it's organic, and I put coconut milk in mine.
Yeah, that sounds good.
Right. No sugar.
Yeah. Right. And so if you've got to have that
cup, only one. I'm down to one.
Right. Okay. Then
I say my water.
Enjoy it though, you know. So if you're going to have that cup of coffee, enjoy it. Don't feel guilty the whole time, because that's negating it, right? And you're getting those negative thoughts and those negative cells and cortisol levels raised. So if you're going to do it, enjoy it.
You know, Deb, we're talking about prevention. I just want to interject something. I have sitting in front of me the Hippocratic Oath, and every doctor at the time of their graduation from medical school takes the Hippocratic Oath. Right. And one of the lines, and I'm reading it directly, one of the lines says, "I will prevent disease whenever I can, for prevention is preferable to cure." And I think we take that and we get out into our training and out into our practice. A lot of people forget that we said that at the beginning of our medical careers. You know, we're also talking about do no harm, which is part of the Hippocratic treatise. And so you're saying to a woman, I'm going to take and put you in a machine that causes cancer, because we know that radiation causes cancer, that has the potential to rupture a tumor and cause metastasis, that's going to cause pain, that's going to damage your cells. But I took an oath that says do no harm. So it's a conflict to what the whole premise of being a doctor is about.
And doctors were given no nutritional education.
Right.
So they can't even,
we're practicing,
not even equipped to live up to the other half of that.
Yep. We're practicing in direct opposition to the oath that we took.
Right. So we have to be our own advocates. You can't just be a sheep and follow. You must be educated, which is why we're doing this podcast. You must be an advocate for your own health. Our bodies have an innate ability to heal. We need information. We need to be responsible for our own choices. There's no unlucky fairy that taps you on the head and says, you know, your luck is up, you get cancer.
Right.
But with 1 in almost 2 people getting cancer now, we need to wake up. And thermograms are so great because it is 7 to 10 years ahead of time. So you have time to get out of the way.
Right. Exactly. Yeah.
And make these choices.
Yeah. And these days we've got so much information at our fingertips with the internet. You know, so many wonderful summits and webinars being done by, you know, the greatest functional medicine, integrative medicine doctors, or, you know, giving their information, their years of experience just for free. So tune into them. There's all the information out there.
We have a wealth of information on our site.
And of course, at your place, yes.
The only other thing I wanted to ask about was the stress connection to breast health. So if you're stressed a lot and your cortisol is raised, doesn't that affect your other hormones also? And estrogen?
Absolutely. You're absolutely correct. Stress increases, sets your adrenals off. The cortisol, everything that you said is accurate. Stress increases pain. Stress decreases the body's ability to fight infection, disease, etc. So it's not only, it's a double whammy, so to speak. It's causing harm to the body and also diminishing the body's own capability to heal itself. And we all have stress. I mean, you can't get through life without stress. And so what I tell people most times is you can't eliminate the stress. You have to find better ways to deal with the stress.
Right.
But if you're eating properly and you're drinking water and you're exercising and all the things that we've been talking about for the past few minutes, so you're taking control of that which you can control. Mm-hmm. And it makes it a lot easier to sort of damage control the stress part to some degree, because you're not trying to, okay, I'm going to have to damage control my weight, damage control my water, damage control, et cetera, et cetera. You're doing that. That's your life. That's how you live on a day-to-day basis. And now you can focus on how can I minimize the stress in my life, whether it's through meditation or yoga or whatever it happens to be for an individual, something that makes you calmer, happier, gives you a time out from the stress to whatever degree you can, because your body's otherwise healthy. So the stress, while it's a factor, becomes less of a factor and less harmful and less.
And I think it has to be a mindful thing that we really come up with some short-term and in the moment maybe, and then some longer-term things for stress. They need to be like part of the toolbox.
Exactly. It's something you do every day.
EFT tapping is only a couple minutes, or if you do some 3-minute meditation and breathing, it can change from the sympathetic, that fight or flight, to the parasympathetic.
Right.
But
just taking time to breathe, right, Debbie? If you just take time, you know, right. Everybody's holding their breath, the shoulders are up in front of computers. So taking time every half hour to just take at least 3 nice, deep cleansing breaths calms down the whole sympathetic system, as you just said. Doing a 3-minute, 5-minute meditation, just anything to move away from your computer, go outside, take a couple of nice deep breaths. And I think that if you look at, if you try to implement all of these changes at once, it's going to be overwhelming.
Right.
So that's why you and I, we call it lifestyle modifications. You do 1 or 2 things, add 1 or 2 things.
Make a salad, do a 3-minute meditation.
Yeah, instead of drinking even a juice or a soda, have some water. Drink a glass of water. If you still want something sweet after that, have another glass of water. Water, cravings for sugar are a sign of being dehydrated. And I found, and I don't know if you found it in your practice, people who are eating healthy, getting nutrient-dense food into their body, have fewer cravings, have fewer mood swings, have much better control of their stress, because their body is able to withstand it. They're centered, they're grounded, because they're getting the proper nutrition. If you're eating sugar and processed food and garbage, you don't have the tools. You don't have the tools to.
Well, sugar lowers your immune system,
right?
Short term and the long term. So you're stressed, you grab sugar, you want to keep going, then you have some coffee, you're more dehydrated.
It's a vicious
It's kind of like changing, like little changes to change that whole feedback loop.
Right, and we're learning so much about the brain and epigenetics and creating new neural pathways. So learning something new every day, creating a new habit, creates new neural pathways. So you break out of those old habits, and before you know it, you're not doing them anymore, and you're replacing the habits that were not necessarily beneficial to your health with good habits. It's called crowding out, right? So when I'm doing holistic health counseling with people, I don't say, okay, you've got to cut this out, this out, this out. I say, why don't you add this, add this, add this, and then the bad stuff's crowded out because they don't have cravings for it anymore, and they don't feel deprived or overwhelmed.
And I think the breast is a nurturing organ. I mean,
right.
it's so I think that if we're not nurturing ourselves, that can be a root cause of breast cancer. So we need to slow down and love ourselves and nurture ourselves, and have loving relationships. This is all part of health. You can't just do it with food alone.
So true.
Right. So I just wanted to add that.
No, I really appreciate you saying that, because, women know if they've got breast cancer, they know where that came from, especially with breast cancer. As you said, it's what we nurture with. We can sustain life with our breasts. We take so much of that, bad relationships or trouble with a spouse or child into our breasts. Right. And yes, taking care of ourselves, women need to know it's not an act of being selfish. It's an act of self-love, and that's okay. You're supposed to love yourself and take care of yourself.
Our founder wrote a book because she counseled 30,000 plus people with cancer, and she wrote a book, Breast Cancer, It's Not What You're Eating, It's What's Eating You.
Yes.
So I just think it's, even if people just hear this, you can't unhear it then. You heard it, it's in your brain.
Right.
And then when you're stressed, I think you're like, oh, wait a minute. What did I hear? I have to be mindful. You know, it
Yes.
just puts that information in your mind. So these are all great things. And I think
Right.
it's great for people to know.
Right. Good.
The only other thing too, hormonal changes. So I had a place that heated up, and I'm 52. I've already gone through menopause. I know my hormones are not right. And then I've had stress on top of that, which I'm sure has then further disturbed my hormones. So the inflammation then, if hormonal changes can cause inflammation, can lifestyle changes and stress modification and all these things, is that enough to bring inflammation down? Is that a fair question even?
Well, I think there's two questions there. The first question is, are diet and lifestyle alterations and modifications enough to reduce inflammation? The answer is yes.
Okay.
Are diet and lifestyle modifications enough to change hormonal balance? The answer is it depends on the individual, because it may very well be that the hormonal imbalance requires some intervention beyond diet and lifestyle. It will have a positive impact, but it may not have enough of a positive impact.
Okay, so then you can test and find out from there. You can test get your hormones tested and make some changes, test again, get another thermogram.
Yeah, I think it's important if you're considering a bioidentical hormone replacement that you have somebody overseeing it, and then you are getting tested. I know you can just go into the drugstore and get creams. We don't recommend that. We recommend that you do have somebody monitoring that.
Absolutely.
Yes.
One of the things that I've noticed is that some women have come to see us and they're on bioidentical hormones, but for whatever reason, they're not routinely checking their hormones. If someone, for example, was on thyroid medication, we would be checking their thyroid routinely to make sure that we weren't giving them too much or too little medication. And I encourage women to have their hormones checked routinely to make sure that they're not getting too much or too little of the bioidenticals for the same reason, because you can, for the most part, determine an estrogen-progesterone imbalance on the thermogram. Whether you have too much estrogen or too little progesterone, the look is the same. It's not so much saying you've got too much of this or too little of that, but the balance is off. And when the balance is off, you can see it visually, but it also creates a lot of symptoms in the body. So I encourage women with that kind of pattern to go back and have their hormones checked to see if maybe what they're getting needs to be readjusted.
Okay. That's great. That's great. And I mean, that's a lot of great information from one test.
Yes.
And no, it's not covered by insurance, but it's not incredibly expensive either. So.
Right. No, we feel like it's reasonable. The cost for a breast thermogram is $300, and we have about 30% of women are getting reimbursed at this time. We provide a universal claim form. But most women feel like, they're worth that. They're
absolutely.
It's like one Starbucks cup of coffee a day or something, It's worth it.
Right.
And I think that the approach has to be exactly that, because we talked earlier in this conversation about mindset and talked about self-nurturing. And self-nurturing includes spending $300 to make sure that you're healthy. And if you're not, to know in advance so that you can do what you need to do to get there.
Absolutely. Absolutely. Wonderful.
Yeah.
This was great information. Is there anything else you want to add?
I guess I'll just, I'd like to just give our contact information in case anybody's interested. By the way, my name is Liesha Getson. I never did introduce myself. I'm a board certified thermography technician. I was certified in 2004. I'm also a holistic health counselor and a Reiki master. So I'm one of the technicians, and there is one other board certified technician that does some of our off-site testing. Our main office is here in Marlton, New Jersey. The address is 100 Brick Road, Suite 206, Marlton, New Jersey, 08053. Our office phone number is 856-596-5834. And our website is www.tdinj.com. Anybody has any questions, or you would like the PowerPoint, you can view it on our blog and newsletter page, or be happy to send it out to you, or as I said, answer any questions you may have.
Wonderful.
Deb, thanks. I want to just thank you so much for having us on today to be able to share this information.
I'm very excited to be able to post this information. It's just very necessary.
Thank you.
Thank
Can't
you.
have women in the dark. So
Now we've got to educate and empower.
thank you so much.
Thank you.
Thank you.
Have a great day.
You too.
Bye-bye.
Bye-bye.